All right, good evening, everybody. Thank you for coming to the second Civic Scholars Lecture. There's a sign-in sheet at the back, so please make sure you do sign in if you haven't already at some point before you leave this evening. At this point, you should already be into your research and looking at your county and getting a feel for all of these different aspects and what it looks like. You should also hopefully be making appointments or reaching out to folks to try to interview, especially if you're going to try and do that over spring break. Please do talk to your mentors if you're needing help or advice, or you can talk to me if you've got questions or are running into any issues that may pop up. So with all of that, the way we'll run this evening, we have a wonderful second guest lecture is Dr. Anna Turner from UF Shands, who's also a community psychiatrist. I can never remember which is which. Anyway, she's going to be giving us a whole different aspect on this issue than we heard from last week, which is great, and we are so very lucky to have her with us this evening. So she's going to get into far more of the health side of things, looking at homelessness, looking at the social issues and impacts that housing has on issues like homelessness and mental health as well. So it'll run more or less as last week did. She's going to talk to us for a while, and then we'll open it up for questions and answers. So please, take notes, especially if you've got questions. Try and save those for the end unless it's something immediate to which she's got. Otherwise, with all of that, please help me welcome Dr. Anna Turner.
So I'm a psychiatrist with UF, and I work in Jacksonville. And so who has Duval County? Oh, okay. And I work at a place called the Soulswacker Center, which I'll get into, which is essentially a homeless shelter that also provides a full range of medical, dental, psychiatry services. And I am really excited about what you guys are doing because your reports are actually going to be very, very useful for my patients, where I work. Like we'll probably actually use some of this stuff. Sometimes you write a report and you think, okay, what's going to happen with it? But I'm really excited about what you guys are doing. So yours better be good. Yeah.
No pressure.
So we'll kind of talk a little bit about homelessness, prevalence in U.S. and Florida. I heard you got a little bit of that last week. And then we'll talk about kind of why would someone become homeless? Is it really difficult or easy to get into or out of homelessness? And then, why, as a psychiatrist, why do I even care about this? Because it is very relevant to our physical and mental health housing. So, does anyone know, so I'm a psychiatrist. What's the difference between a psychiatrist and a psychologist? Does anyone know?
A psychiatrist can provide medications.
Yeah, that's the main difference. So I can use medications. You don't have to write that down. So as a psychologist, they can do undergraduate training, and then they usually do some graduate training, 4 or 5 years, maybe get a PhD, kind of mostly academic setting. A psychiatrist does undergraduate and then does medical school for 4 years, where we get trained in everything from like delivering babies to surgery. And then after that, we spend 4 more years of just psychiatric training in residency. So kind of a longer route, but it allows us to understand a lot of medical aspects of mental health. So for homelessness, the national estimates, this is from 2017, you can see that the states that kind of have the highest population have kind of a higher prevalence of homelessness. And then, I would think there would be much more southern states with a higher prevalence. That could certainly be why Florida's on this list. But also we just have some of the major cities. So you'll see like New York has a very high prevalence. So if we zoom into Florida, back in 2017, so it's been trending down since the recession, so that's good. But we still have 16 in every 10,000 experiencing homelessness. Anybody know what the difference between unsheltered and sheltered means? Pie chart. What does unsheltered or sheltered mean?
unsheltered would mean like you live outside, and sheltered is you have somewhere where you can go at night.
Yeah, exactly. So either sheltered could be an emergency homeless shelter, or staying with friends, or staying on somebody's couch surfing. So 46.8% are unsheltered, are outdoors. So when the weather gets bad, they don't have shelter to protect themselves. So zooming into Duval, Nassau, and Clay counties, Florida, when they do statistics on homeless, they kind of lump our counties together. You can see it's been trending down, so that's great. We're kind of staying steady around 18,000 in Jacksonville, the Duval County area. In 2018, it was about 1,700, and then this year we just did our census. Does anybody know how we come up with this number? Has anyone heard of the point-in-time count? It actually just happened. It happens in January every year across the country, and it's a great thing. They always need volunteers, so they do it everywhere. Wherever you go next year, you could always look for it. But it's basically just a bunch of volunteers go out on the streets and kind of look for people who are homeless, and then you have to ask them all these survey questions. And they do it at like 4 a.m., so people are really pleasant with you when you wake them up. We do it in January, I think, because, in places like, Washington or Michigan, hopefully the majority of people are in a shelter at that point. So you're not finding too many people on the street. So we think that helps our numbers by doing it at a really cold point in time. However, as you could imagine, that is not maybe the most accurate estimate if you're relying on volunteers finding people on the streets. And so some estimates say you could actually triple this number that we get from the point-in-time count, and that would be more accurate. Because, again, it doesn't count those people who are staying with friends, couch surfing as we call it. And there's a good quote, like, it's not a sleepover if you can't go home. So this really doesn't count a lot of people. The estimates in blue are just the total, and then the red is the chronically homeless, so people who've lived a year or more without a home. So what's interesting is all the providers in Duval County, can you guys hear me? Is this microphone? Okay. All the providers in Duval County kind of pull their data, anyone who services people who are homeless. And so we can see in Duval County that the majority of people are adults, but there is a fair number of teenagers and young persons on the street. What I find interesting is chronic substance abuse is about 13%. In the general population, alcoholism is about 12%. So it's not like some drastic difference. Severe mental illness, that would be things like severe depression, bipolar, schizophrenia. That's about 14%, maybe 15%. In the general population, that's about 4%. So that is much higher than the general population. But still, 85% of people don't have severe mental illness who are homeless in Duval. And so I think that really speaks to the fact that anyone, just like you and me, could be homeless. And I've experienced that in my work. I actually have a lot of medical students that come and train with me, and some of them have experienced homelessness themselves, and they are literally like you and me. So here's an example. We talk about homelessness and how does someone become homeless. This is kind of a good example of how it could happen. This is called Hobson's Choice. And when remoting in, you can just kind of Google it. It's a great simulator. So I need a volunteer. And I'm going to be picking more than one volunteer. And the first volunteer is its easiest. Who wants to volunteer first? All right. All right, so this is called Hobson's Choice. And can you kind of zoom in so they can see it better up there? Anybody know? Do it sort of zoom in. Oh, there we go. There. Okay. So I'll kind of read it, but you can read it on your own too. So this is just a game we'll go through, and you get to answer. You get like multiple choice answers, and then we're going to see how well you do if you end up homeless or not. All right, you were hospitalized and could not work for 3 weeks. You have no savings or insurance. Your landlord says pay up or get out. So do you go apply for welfare, talk to your landlord, tell him I was just in the hospital, try to borrow money from your friends, or go to your parents' house?
Talk to landlord.
Talk to your landlord. Your landlord says, what do I look like, the Salvation Army? Pay up or get out. So do you borrow money, go to welfare, sleep in your car, or ask a friend for couch space?
I say ask a friend for couch space.
Ask a friend so you can stay with a friend. Your friend friend is out of town. Sorry. You sleep in your car, go to your parents' house, go to a shelter, or go to welfare.
Let's try the parents.
Always rely on parents, that's good. Oh, they don't want you around, sorry. You don't have a good relationship with them, I guess. Sleep in your car, try to borrow money, talk to your landlord, or go to welfare.
I guess try to borrow my. Oh, your friends are not in town then.
You might have other friends.
Okay, let's have other friends. Let's try it.
See if you have other friends. Oh, no, you're right, you're right. Your friends are
Outside.
lieutenant.
Well, I guess I go to welfare.
Go to welfare, okay, let's see. Welfare gives you some paperwork to do. You have an appointment in 3 days. So do you go to a shelter, or do you just wait for your appointment in your car, maybe, on the streets?
Oh, you go to the shelter.
Okay, I'm gonna try a shelter. Oh, the shelter is noisy and crowded. You don't think you belong here, as if anyone does. So do you still stay? Do you go to your parents? Try getting day labor, or sleep outside?
Try getting day labor.
Okay. Do you know what day labor is? Those are like,
Labor during the day.
yeah. It's like you can show up at a work site and they might have work for you to do that day.
Yeah, let's
So
do
you
it.
might get like a construction job a lot of times. You work half a day and make $15.
Wow.
That's not enough to pay your rent. Do you sleep in your car, go to your parents' house, ask a friend, go to a shelter?
Go back to the shelter.
Yeah, gosh, that's kind of your best option here. Oh, it's too late because you worked too late. So anybody, you know about like shelters in town? What's the name of a shelter in town? Grace Marketplace. What else? St. Francis House. So St. Francis House has a time. You have to be there by, I forget what time it is now. In Jacksonville, we have Trinity and City Rescue. You have to line up by 2:30 to get a bed. So if you worked, you can't get a bed that night. Grace Marketplace is more, I think more like Soulsbacher, where you kind of get a bed and keep it, but you kind of have to be on a little bit of a wait list to get your bed. So your shelters are full. So do you sleep in your car, sleep outside, stay with your parents, or try getting more work?
More work.
Okay.
Let's see what I can.
You don't get anything today. So do you just stay where you are, go to welfare, try to borrow, try getting day labor?
Where's welfare at with their paperwork?
Oh, that's a good one. Let's see. You want to see?
Yeah, let's see.
Oh, no. They treat you like an insect. So you get mad at me.
What is that? Let me see if, alright, well, my parents are out of town, they didn't want me there.
That's true.
Oh, they didn't want me there. Let's see if my friends are back in town.
Okay. Oh, you don't have my friends now.
Lost all of them, they left me.
You can go to a shelter, back to welfare, go to your parents' house or something.
Let's see if my parents will help me out here.
Okay, let's ask your parents nicely this time. No.
Parents don't love me. Is the shelter now open?
Yeah, that's true. So you guys need to appreciate your parents. This guy doesn't have good. You were staying in a shelter. Okay, great. So now do you look for more affordable housing? Do you try getting day labor? Do you go to welfare? Do you go to your parents' house?
Do I have money to look for affordable housing? Let's look for affordable
Let's
housing.
try, yeah, let's see. The shortest waiting list is 6 months long. You sign up, but you are still on the list.
Let's sign up. Let's go back to the shelter.
To the shelter. They seem to be good. Oh, it's too late.
Of course.
The shelter's already full.
Let's get some day labor.
Okay. Congratulations, you got a job unloading trucks. You make $32, but you still don't have anywhere to live. Should you go to your parents' house, go out drinking to celebrate, go to welfare, or try to borrow money from friends?
Let's try welfare again.
Did you see how someone might want to celebrate after that, though? That was like a victory. Welfare gives you some paperwork to do. Oh, and you have an appointment in 3 days. I think they lost your original appointment.
Alright, let me wait for my appointment.
Okay. You
friends now that made $32.
Let's see.
Yeah, look at that.
Okay, yeah, you got some friends. Still not enough. I think we could probably pause here though, but because I think
Okay.
you guys get the point. You know, it's pretty hard if you don't have a job and just getting kind of day labor doesn't really make that much money. And if you've maybe burnt bridges from other reasons and you don't have supportive family or don't have supportive friends or rich friends, you know, it can be very hard. So, you know, that was like an example kind of nationally, but we'll talk about Florida. You know, the average 2-bedroom rental in Florida, if you're earning minimum wage, you would have to work 99 hours a week to afford that. If you wanted to work 40 hours a week, you'd have to make $20 an hour. So if you don't have a high school diploma, that's basically impossible. So you can see how easy it is for someone to become homeless. You know, it's really actually hard to get housing. So when you guys make your, you know, identify what is affordable in these areas, it's really going to be helpful. More cost of homelessness. So our society, you know, when we, you know, basically have homelessness, in 2014 there was one study in South Florida that looked at people who are homeless and how much kind of they cost our society. And there are things that we pay for to essentially keep people in homelessness. You know, every time they're arrested, that costs money. They get arrested for like misdemeanors like trespassing or open container. Every time they go to the hospital because they haven't been taking care of their health and now they might be having a heart attack, that costs our society money. And in fact, this one group in South Florida found about 107 of kind of the highest utilizers of the system, and just for each person per year, we were paying $31,000 to keep them in homelessness. However, if we were to find affordable housing, it would cost us $10,000 per person per year for each of those people. So it would save our society money by having affordable housing. So again, what you guys are working on is going to be really, really important. And so you can think like how that's an astronomical figure. How does that even work? So in this study, it looked at just in incarcerating someone for like an open container. It costs $104 just to book them. Anytime you're arrested, that's going to be the price. So out of all those people, it cost $130,000 just to book them once they got arrested. They actually ended up staying an average of almost 50 days every time they got arrested. And it costs about $80 per person per day in jail, you know, to keep the lights on in jail, to feed them. And so that is a total of almost $5 million just to keep them in jail, just for 50 days. And then over time, if you add that plus their booking, you know, it's basically $6 million over 10 years, or $641,000 in 1 year. Or per year, yeah. So we're spending a lot of money on incarcerating people, and sometimes it's for very minor things like, you know, trespassing. If you're trying to stay on a park bench at night because you have no other place to go, or even if you're parked in your car, you sleep in your car in a grocery store parking lot. You know, you could get arrested for that. So why do I care about this as a psychiatrist? This is a video of one of my friends who does the same thing I do out in Nashville. And so I thought, this is a really good video, but my department hasn't paid for me to have a video. We'll watch her video. But it really highlights kind of what it is I'm doing and what she's doing. Well, how do we get sound?
Left when they are on our right. When we're driving on the highway, we naturally have no idea that just feet away is a large homeless encampment.
Let me make it big screen.
We pass by people who are struggling with homelessness all the time, and we frequently look to our left when they are on our right. When we're driving on the highway, we naturally have no idea that just feet away is a large homeless encampment. I was always interested in theater and singing and sports, provide medical care to individuals who are homeless at point of contact on the streets. Our program has evolved tremendously over the last 3 years. We've hired a homeless housing navigator, a homeless disability coordinator, and a psychiatric nurse practitioner. Vanderbilt's providing me with the opportunity to teach the next generation why they went into medicine in the first place. We are kind of flipping this model of care. So when we see patients in our hospital system who are homeless, we are providing these extended type of services that have never been provided before. When we go to a campsite, generally the protocol is to yell out, "Hey, this is Vanderbilt, doing some outreach today. Anyone home?"
We have some supplies. Do you guys need anything?
Most people know what that is, and that usually means that somebody is willing to talk to them and give them some time and usually trust. I think it's different for me too because I'm in my jeans and I'm in a t-shirt, and while there are probably slightly different boundaries, like there are probably more hugs on the street than there are in a hospital setting, it's still important in this environment that we treat it like a clinic, because we are a clinic. We have about a 95% show rate for our appointments, which is much higher than general outpatient clinics. I don't think I knew it then, but I think I realize now that I needed to be a doctor. I had to be. I think our society believes that individuals who are homeless are lazy or they are using drugs or drinking, but the reasons people are homeless are really variable. Looking at that person in their eyes and meeting them in their world is something that could kind of redefine not only how we see medicine, but really how we see our system of care and how we really see society.
That's cool. So, we do the very same thing, going out. And I work in a typical clinic as well. So Sulzbacher Center, it was originally created as a homeless shelter. It's in Jacksonville, Florida. And they slowly added on all these services. So now we actually have a fully staffed medical, dental, psychiatry, substance abuse treatment center right on staff. And so several days a week I just have a regular clinic. People can come in from that. And then one half day a week I go out with the HOPE team and do street psychiatry like Dr. Flesch. So if someone stays at our Sulzbacher Center at the shelter, they get a case manager who they meet with at least once a week, and they work on maybe building a resume or applying for jobs, basically trying to get them out of homelessness. And I think if you've heard of Grace Marketplace, they're working closely with Sulzbacher trying to kind of build something similar there. So the average length of stay for people at Sulzbacher is about 3 months. Some people will stay much longer, and some people much shorter. We don't allow pets, but we have this great contract with a vet in town that will take the animals for 30 days and spay and neuter them and give them all their shots while they stay. And then if you're married, you can stay together in our family section. But if you're not married, you have to split up and there's a women's center and a men's center. And so a lot of time if someone's on the streets, they kind of partner up for safety, and that might be difficult to leave their partner. And so a lot of times it's hard to get people with pets or people who are partnered up to kind of come into our shelter. So I mentioned the Federal Qualified Healthcare Center. We also have a program called Medical Respite. So if somebody gets hospitalized for any medical reason, like they just had a big open heart surgery because they had a heart attack, or maybe they got a bad leg infection and they now need like 6 weeks of IV antibiotics. So recovering from an open heart surgery could be a lengthy process. If we were to keep them in the hospital, that's like $1,500 a night to stay in the hospital. And so our medical respite is an alternative to that. We can have the hospitals pay us $100 a night and they can stay in our medical respite, where they get all those same services everybody at the shelter gets, access to medical, dental, psychiatry. We'll drive them to physical therapy appointments, whatever they need. And then, so it's a major cost saver for the hospital, and then it generates a little bit of income for us too. Although we we often let them stay much longer than the 30 days, so I don't know if it's really much of a moneymaker, but, what else is this? That's pretty much it. So the Solsbacher Center, you know, if someone comes to the Solsbacher Center, we're really meeting a lot of their needs. Has anyone heard of Maslow, this hierarchy of needs? So you might come across this in psychology. You know, Maslow said, like, you can't achieve these big, great goals until, like, your basic needs are met. And those first physiological needs are food, water, shelter, warmth. And that's literally what we're doing at Solsbacher. And then we kind of build on it from there. So if somebody comes to me and they're having trouble sleeping because they're outdoors on the street at night, like, I'm not going to throw a sleeping pill at that. Like, they need a safe place to stay. They need access to food more than once a week. And so I feel like, you know, places like Solsbacher Center or Grace Marketplace, they're building up to be able to do these things for people that really have big needs. What's also nice is our medical center. You don't have to live at the Solsbacher Center to use it. Anyone 200% below the poverty level in Jacksonville can also use all those medical, dental, psychiatry services. So we open up to all the uninsured. So if you have anyone you know in Jacksonville that needs health care and they can't afford it, just tell them about the Solsbacher Center. So I thought, I don't have my phone, I forget how long it's been, but I thought I have a couple cases of patients I've worked with. You probably don't need a break, I don't think. Okay.
It's only been 30 minutes.
Oh, okay. So I'll just go through some cases of patients I've had. So there's lots of reasons. I mentioned our HOPE team, and that's where I go and do street outreach. So our HOPE team is made up of 2 case managers, Jackie and Ruben, and they go out every day and just kind of check on people who are on the streets. And they offer them sandwiches or recommend like services. You know, if somebody needs to know where to go X, Y, or Z, they can tell them. And what's great is the city of Jacksonville actually funds the HOPE team. And you know, their goal is to catch people new to homelessness so that we can get them in the right direction and get them out of homelessness. So what's nice is this whole city of Jacksonville kind of knows about it, so they use us for different reasons. So sometimes the police might call us for help, but in this case, an area business person had a guy that was living in their doorway. And it was nice, instead of calling the police, they called Solsbacher, and they were like, hey, this guy, he's talking to himself, can you go make him come to your shelter? And so we can't really make anyone do anything, but we gladly offer to go, oh, we'll go talk to him. So the first time we go to see him, he actually just runs away. He left like tons of stuff in the doorway and just took off. Like he did not want to talk to us. So we tried again, maybe the next week or next day or so. And we were like, no, we're just here to give you a sandwich. We're not trying to do anything. And he was like, oh, no, thanks. You know, not interested. So then we just keep trying. We're very persistent. And finally, the third time, he agrees, okay, fine, I'll take your sandwich, you know, but he didn't want to talk at all. And so finally, maybe a week or 2 later, he finally was talking to us. And so I tried to talk to him as much as I could. It happened to be a day I went out that he agreed to talk to us. And he's just very psychotic. And, you know, most of what he talks about, he can't really answer my questions directly. So as a psychiatrist, I kind of am faced with, is this person in dire need of mental health services? Do I need to hospitalize them, maybe against their will? Has anyone ever heard of the Baker Act? Okay, and so what is that?
It's where you think that the person is either going to harm themselves or someone else, and so it's like a mandatory possible
Yeah.
for 24
72, yeah, 72, yep. So it's Florida's involuntary commitment law. And so every state has one. Ours we call the Baker Act, but other states call them all different things. And so I might say I need to hospitalize someone against their will, essentially, because they can't make that decision. They have to be in dire need, though. It has to be due to a mental illness, so they can't just be threatening to kill people and get Baker Acted. Like, they could also go to jail for that. But if it's due to a mental illness, you know, if they're suicidal or homicidal, or severely neglected, like really bad dementia, and can't take care of themselves. But you know, this guy, he's taking care of himself probably better than I could on the streets. You know, and if I were to force him into hospitalization, then he would definitely not talk to me after that. torn, but I really didn't see need for hospitalization. And so we keep visiting for a little while, and then eventually he just kind of, him and all of his stuff were gone from the doorway. And it's like, oh, how did that happen? So we keep looking for him, but didn't really hear from him. So then Jackie, our Hope case manager, gets a call from the police later and says, oh, this guy, there's this guy, and I don't know what to do, and he's in front of this really fancy business area we have downtown, and you gotta come get him. And so Jackie drives up, and she's like, oh, I know this guy. We'll just call him Jeff. Hey, oh, it's Jeff. I know him, Jeff. And then the cop's like, that's not his name. He's George. And it turns out, Jeff was actually George, and the police had gotten all kinds of information from him. And so Jackie says, the cop's like, what do I do? I don't know what to do. And he's very, very psychotic. And so Jackie says, he needs to go to the hospital. He really needs it now. And so the cop can place a Baker Act. It doesn't just have to be a doctor. So they brought him to the hospital. Jackie followed him and left her personal cell phone with the check-in desk and was like, call me when he gets out. We got a bed for him. So of course the hospital does not do that, and they just discharge him. That was maybe on like a Monday. So Thursday I go out and I say, let's go look for Jeff. And Jackie's like, well, that's not his name. And so we drive all around and we can't find him, and he's not in this place where we originally saw him. He's not in the fancy new place. So we're like, all right, well, we'll just go back. And sure enough, the last place we look, there's Jeff or George, whatever his name is. And he's literally a new man. Not only does he have a new name, he says, hey, doctor, it gives us all hugs. And he's like, they started me on my medicine, and he knows the name of it. And he's like, it's working really well. And so, the hospital got him stable enough so that Jackie says, all right, well, you're going to be here tonight, or do you want to come into the shelter? He's like, I don't want to come in the shelter. So she's like, all right, well, I'll pick you up in the morning. And she takes him to go get a shower and gets him some new clothes, and then tries to help him get an ID, because an ID is very important when you live on the streets. You have to get it to get any kind of services. So that is just a really, one of my favorite cases of where the hospital really helped. But it really takes more than just one person, right, to help him. So this is, some places we go out, it's not in the middle of the city. Have you ever seen like a footpath like this around? It usually leads to like a little encampment. And I remember when I lived in Gainesville, you could see footpaths everywhere around here. There's not as much like wooded areas in Jacksonville. But if you were to follow that little footpath, you might come across someone who's sleeping out there. I don't encourage you to go do that. We always go out in teams, for safety reasons. But it's just something to think about, that there, if you're seeing a bunch of footpaths, what does that mean about our community? And is there enough housing for our people? So this is a case of, this is not his name, but he's New York Nick. They call me New York Nick because I'm from New York. I'm like, oh, I couldn't tell. So he lives in like a little encampment like that. And he just eats what he finds. He kind of, actually he collects money by, he goes and digs through trash cans and finds cans, and then he can use that money, he buys beer. But when he's digging through the trash can, he also finds food to eat. And so you can imagine that may or may not be the healthiest option. And then he uses money for beer, which is also not that healthy of an option. But so we check on him pretty frequently, and this time, I'm always thinking like, how can I get Nick to come in for a detox? I would love for him to get detox. Well, on this particular day, his leg was hurting, and I was like, do you want to go in for a detox? And he said, yeah, maybe they could help my leg too. And I was like, yay, okay, great. So we drive him to the hospital. Again, Jackie leaves her personal cell phone at the hospital. This is Nick's leg. Does anybody know what this is? It's like little white things that are like maybe pulsating.
Maggots.
These are maggots. Nick had such a bad infection that he had maggots on his leg. This is a picture from the internet, but this is essentially what Nick's leg looked like. And so what's interesting about maggots is they actually keep the wound clean. And so it can be kind of dangerous sometimes to remove the maggots. Not at this stage, and luckily at Nick's stage, we could remove the maggots and treat it with antibiotics. But in some cases when it's really, really bad, actually if you were to remove the maggots, bacteria would just explode and just like then you lose the limb. So in some like northern places where gangrene or frostbite is real, happens more often than Florida. They have to actually, pay attention to this. So Nick went and got his leg treated, luckily, and while he was there, he agreed to get some detox, so that was great. So he went in on like a Tuesday. Unfortunately, it was the weekend that Hurricane Irma was headed towards Florida, and it's great we have that, prediction. We knew a week ahead of time. But the hospital was like, you know what, Nick, we need the space in case a hurricane comes through, so you gotta get out of here and go back to your tent before the hurricane comes through. Now, if you were to say that out loud and say, Nick, we need your bed for people who might need it during the hurricane, you go out and live in your tent during the hurricane. Like, when I say that out loud, is that ridiculous to you? It feels very ridiculous to me, but I don't think they were really thinking that far ahead. So they gave him a paper prescription for his antibiotics that he's going to need for his leg infection. And again, they don't call Jackie. She gave her personal cell phone. So on Thursday, luckily we knew to check for him, and I checked, and it's like, oh, he's discharged. We got to find him. So I said, Nick, what if we go to a different hospital? He's like, okay. So we just drive him to a different hospital. This time they keep him. The hurricane hits on a Sunday, and then they discharge him Monday. And again, give him a paper prescription for his antibiotics. So there's something in medicine that's really important that we teach a lot that is very, very useful, and you need to know this. It's called evidence-based medicine, where we don't just say, oh, I had this patient that did well on X, Y, or Z. Like, you actually look at the evidence and say, X really helps and Y does not help, and this is what we're going to pick for you and why. And so evidence-based medicine is really important. And that's probably what guided the doctors to say, you have an infection, I'm going to give you this prescription. And that is what the evidence suggests. But what Nick needed more was like reality-based medicine. Handing Nick a paper with a prescription written on it right before a hurricane, was that really anything that was going to be helpful for him? And so, we kind of have to examine what does it mean when we say discharge a patient to shelter? If we say, go show up at Grace or go to St. Francis House, what does that really mean? It might mean he's in a room with 90 other people. And that might not be what Nick wants. The doors closed at 2:30. We didn't show up at our shelter on time when we did our example. So if I'm discharging a patient afternoon, they're not going to get to a shelter in time. Or is there a wait list for a bed? What's nice is at Sulzbacher, we don't have like the lining up every day. You get to keep your bed once you get a bed. But that means you might have to wait a week or two to get your bed. And so if at Sulzbacher, if you have a job, you're gonna have your bed every night. You can come home from work. If you have a night job, we'll hold your bed. You can sleep during the day. So it might literally mean living on the street. And what is that literally like? We saw that tent. And living on the street during a hurricane, is a tent really going to be helpful? What supplies is Nick going to need? He's got this leg wound. Does he need bandages? Does he need something as simple as dry socks when a hurricane comes through? And then again, like, what's the point of giving him a paper prescription? Like, he's not going to go to a pharmacy, wait in line, pick up the med, pay the copay if he has one. And then also this particular antibiotic they gave him was a 3 times a day dosing. So do you think Nick, who might not know what day it is going to remember, oh, it's been 6 hours since my last antibiotic? No, that's terrible. He's not going to do that. And so actually what we could do is convert it to a once-a-day antibiotic, and our case manager drove out and gave it to him every day. Changed his socks when they needed it, maybe gave him more gauze and let him change his own bandages. And by some miracle, his leg actually healed. So these are just kind of pictures of when Hurricane Irma came through. It was like the biggest flooding Jacksonville has seen, because the St. Johns River runs right through downtown. And so there was tons of water. This is actually St. Vincent's Hospital. The people who got stuck working that night, all their cars got flooded when they were parked in the garage or parked out in the lot. And then this is like right on the river. You can see like the cement block just got lifted up. That's how powerful that water was. And then just these docks to nowhere, everywhere for like, it was like this for like 2 years. Everybody's docks got knocked out. So I had like 2 or 3 patients that stayed out during Hurricane Irma, and one of them has been on the streets for like 20 years. She's like, honey, this ain't my first hurricane. I was like, oh my gosh. But people are really resilient. They're really resilient. So this is our third case. So this is Harry. All these are made up names, but real cases. So he's a 65-year-old. He's got a pretty extensive history of being on and off the streets for a long time, and then also a pretty extensive history of alcohol use disorder. He was probably drinking at some point, and a car actually hit him. And he went to the hospital, and the hospital said, hey, let's get you to Sulzbacher Respite. And so that was that great cost saver we kind of mentioned. The Sulzbacher Respite, he really liked it. He was trying to do well. He came and saw me. That's when he met me. He was working with his case manager, but we don't allow consuming alcohol or drugs on campus. If you're doing it off campus, we don't do drug testing or anything, but you can't do it on campus. So his first time he got caught drinking, they said, this is your warning, you can't do it again. And then he did it again. And so Sulzbacher Respite had to say, look, we can't keep you here. And so me and his case manager were both like really bummed, and we're like, what are we gonna do? How can we find him housing? We tried to get him into one of those nightly shelters. So then about a week later, he tells me this story after the fact. Here he's like, I thought I was at my rock bottom. I get arrested for public intoxication. He's like, this is just the worst. Not only have I now left Sulzbacher Respite, like I'm in jail, and I'm just like hopeless, totally hopeless. And he shows up to his arraignment, and the judge says, well, you can serve your sentence, or you can join this new CHOP program we have, where we try to divert all this money going from jail to now we just pay for housing for you. So do you want to serve your sentence, or do you want housing? So he's like, I want to do housing. I want to take the CHOP program. They've had like a 99.999, applicant acceptance. There's one guy that keeps turning them down for this program, but most people go for the CHOP program. So the CHOP program is put together through all these different programs in Jacksonville, and what they do is they provide case management. And right away, you go from that arraignment hearing, you say, all right, I'm putting you in a motel. They just get you in a motel, and you might stay there. We said that housing wait list was like, maybe several months. So stay there. Your case manager helps you start applying for your Section 8 or your HUD housing. And then in a couple months, you get your housing. And there's no requirements, like you don't have to get sober, you don't have to go to doctor's appointments, but a lot of them do. And in Harry's case, he actually did. He said, well, if I'm gonna have to wait 3 months in a motel, I might as well spend that time in a rehab. So Harry did rehab, and he finally got sober. He got back connected with his sister, who meets with him every Friday and takes him grocery shopping. And then now he's got his apartment, and he's taking his meds regularly, and he's still sober, and he had a great holiday with his family, and like this program totally changed his life. And so this is from the CHOP program. This is just the Jacksonville program. Just looking at the blue is before people went into CHOP, and the red is after. So 15 people, the year before they went into CHOP, they were arrested, however many arrests or days in jail is all that blue. After the CHOP program, way less arrests, way less crisis stabilization, hospitalizations, and this is the cost. So blue again is before, they're spending $80,000 a year on 15 people, and after they're spending $14,000 a year on 15 people. And so this has been a major, cost saver, but then a life changer for people too. So it's just been amazing. So this is the Sulzbacher Center. Where I work. This is the jail. We're conveniently located across the street, right under the overpass. This is the men's shelter. So you just check in here to get a bed, and then this building is the medical building. So we have this whole building for like medical, dental, psychiatry, substance use. We have this intensive outpatient program. People come 4 days a week and can get substance treatment. And then if you live there, we give 3 meals a day. If you don't live there, we open up lunch and dinner to everyone in Jacksonville. So anyone can come get a meal. That'd be fun. So my last case, probably the quickest case. So what's great is Sulzbacher just this summer opened something called Sulzbacher Village, which is for women and families. So we also used to be all on the same campus, but now they built this beautiful 3-story building with tons of like shelter beds, but then they also built affordable housing on the site right there. So people can move into apartments. IKEA donated like all the furniture, silverware, like you move in and you've got everything. It's amazing. So this is just, a patient I have that she was a mother of 4 and she lost her job. And her husband couldn't afford the child support he was supposed to be giving her. They were on good terms, he just couldn't, none of them had any money. And so she showed up with her 4 kids and they put her into emergency shelter housing. Her case manager helped her kids get into, we have at the village, we built Florida's first trauma-informed daycare center where all the staff there are trained in how trauma affects children. So 3 of her youngest were young enough for that daycare and one of them was in school. What's great is in Duval County schools, they'll bus you to your home school because as you can imagine, if you're kind of in and out of homelessness, you change schools a lot. And so Duval County actually picks them up and takes them back to whichever school they were going to. And so that's one less stressor for the kids. You don't have to meet all these new teachers or kids in your class. And then the mom even eventually got a job at the daycare center and then qualified for what's called rapid rehousing. Did you guys learn about that? Someplace, yeah.
It's like, wait. Well, I only know it in the context of like domestic violence.
Oh, okay. It's just like a housing program that is offered in different cities that's rapid, meaning like a couple months. but so now they have housing. They have school, they have housing, and she has a job and income. And so hopefully it will prevent her from becoming homeless again. Once they graduate from the Sulzbacher, they still get a case manager for a whole year after to try to keep them out of homelessness again. So we talk in America, our big thing is equality, but I'm hoping that some of these cases will illustrate that equality isn't always what's needed. Sometimes what is needed is equity. Some people just need a lot more support. And I think that we as a society don't want to see people homeless. I think no one in America would say, yeah, I like homelessness. Everyone wants to end homelessness. The question is how. And sometimes it takes a lot. We need to give maybe a lot more support to some people. You've heard about cases where the police had to help them, our HOPE team, like there is a lot involved. And I really think that is what, not only is what is needed and what is most helpful, but it can also be most cost effective. We saw some of those programs. And so I'll leave you with this, a quote by Gandhi: "A nation's greatness is measured by how it treats its weakest members." And so really what we need to think about is, are we providing equity with our housing and with our access to other care? So that is everything.
All right, thank you. Let's open it up for questions. Anna certainly gave a lot to think about, especially for Duval County, but you can see how programs and there may be similar, whether it's centers or programs that are going on in your counties as well. So please don't be shy. Fire away with questions.
First off, just like thank you for this talk. I think it was awesome. But also, I had a question about like the book. So when y'all go out and like make contacts with people, how do you go about establishing like that sense of trust?
Yeah, it can take a lot sometimes, and Jackie's been doing it for like 20 years since they started. She's like, we used to get cursed out a lot, but we don't get cursed out as much anymore. Even just we just drive by and we just try to look for people who might be homeless. So sometimes we might be wrong. We might be like, hey, do you need a sandwich? And they're like, I'm leaving work right now. So that doesn't happen too often though. So we start off not by like requiring anything of them, and just we really use these items of engagement like sandwiches, food, and then we carry around hygiene kits, and we really try to make them know like we're not requiring anything of you, we're just bringing this out, and like we're Sulzbacher, that's what Sulzbacher does, and so they're like, oh okay, I'll take a sandwich, and so it really takes time. It's not going to happen that first time I meet them that I'm going to do this great psyche eval and just figure out which med they need to meet on. It's going to be a couple visits before And Jackie and Ruben, they go around every day and then they say, oh, that guy probably needs to talk to Dr. Turner on Thursday. Let's plan on that, They also bring out on Wednesday and Thursday mornings, bring out a nurse practitioner that does primary care as well. So, I might do a little bit of primary care, but mostly Peggy is our nurse practitioner. She'll do that. Trust in psychiatry is really difficult because some people have been involuntary hospitalized, maybe even more than once, and maybe held down to be given medications against their will. So some of them have had really bad experiences with psychiatry, and so sometimes I don't right away say I'm a psychiatrist. I'll say I'm Dr. Turner. You need anything medical, and then once they see, oh, she's not such a bad person, then I'll say, well, actually, I'm a psychiatrist. If you ever want to talk, let me know, and then I kind of go from there.
Typically, how do people become homeless? Like, when you ask them, like, how did you end up in this situation? What is usually their reason?
It's usually not any one reason. It's a lot. Some of them come straight out of jail and say, like, my family won't let me back living with them, and now I have no place to go. And maybe they ended up in jail because of other reasons. A lot of times, addiction could be involved, but sometimes it's just like that simulation we did where you're just so strapped for money. Something major happens. I have one guy he got hospitalized for a really bad case of diabetes, and all of his income had to go to pay this hospital bill because he didn't have any insurance. And so then he has no more spare income and gets a second hit of lost my job, and now he has no place to go. So it's usually an accumulation of things. And that's what's, I've visited other countries who still have homelessness, but like in the Netherlands, they have universal health care. So I'm not saving for a medical emergency, and it's just a totally different, my case with the diabetes, he would never have been homeless over there because he would have had health care covered all the time. So there's lots of different reasons. Good question.
Does the CHOP program, do they collaborate with organizations like yours, or?
Yeah, it's a lot. Let me pull it up. It was like Sulzbacher, the Salvation Army's involved, Lutheran Services Florida, like DCF kind of involved with them. Ability Housing is a housing area in town. This is, DCF obviously is involved, and then the state attorney. So it's a lot of partners for sure.
Do you know offhand, are there other counties that have a similar program to this?
I don't know which ones, but I know that we're not the first.
Okay.
But I think there are.
So then some of you may find something similar to a program like this operating. It probably won't be the same name, but it gives you an avenue for which to find out, though.
I think like Dade County might have something similar, if not the same type. They have a lot of mental health programs that are really effective, and it's jail-related programs.
Do you work with the city or the county to develop, not necessarily affordable housing policy, but just different ideas?
So me personally, not as much. I try to advocate where I can, like by voting, by sometimes I'll go up to the state, like Tallahassee, they have big mental health days, and I'll go to that and try to advocate. But where I work, Sulzbacher, they have a whole department just dedicated to like grant writing to have sustainable, medical care and shelter. And so they have people who are very heavily invested in working with the city and advocating. And so actually what just happened last Thursday on Valentine's Day is they opened a brand new urban rest stop on our campus where people can stop and use a washer and dryer, use the showers, and they relocated this as a case management service there. So you can get case management, do your laundry in the same day, and and that was put through because people advocated at the city level, like this is really what we need, and the mayor came to that and was like, he was real supportive of that. So.
Do you find that most people in Duval County, most people know about the center, or do you talk to them about it?
Right, it's really variable. Like some people are like, oh, I've been there before, but a lot of people who are new haven't heard of it. or maybe somebody was like, oh, somebody told me about that once. So it is, you know, you still kind of have to advertise however you would do. And so actually one day of the week, I work in the hospital in Jacksonville, UF Health there, and I often can kind of, you know, when I go see patients there, I'm like, oh, have you heard of the Solzbacher? I work there too, come see me, you know, so.
What are some preventative measures that can be taken in terms of homelessness? And it might be similar to how people become homeless, that it's variable. But like, are there any certain traits that we can look for or programs set up to help in that sector?
That's a good question about preventing homelessness. I think early childhood interventions are really, really important. You know, like kind of ending the cycle of trauma. A lot of them kind of get in situations where they're stuck in daycares that aren't the best, or they're stuck staying with a friend of a friend, and you know, because their parents are working 3 jobs. And so if we can intervene and prevent childhood trauma, I think that is a major you know, way to prevent homelessness. But again, like the homelessness, there's so many reasons people become homeless. There's going to be lots of needed, you know, resources to prevent it. There's something in Gainesville actually called Peace for Gainesville, the number 4, and they, Dr. Lewis is a psychologist in the psychiatry department, and she's helping kind of do a lot of Gainesville interventions and early, you know, trauma prevention. So Gainesville is a really good like site for mental health and wellness here.
Do you think like homelessness can lead to people having mental illnesses or like
Yeah.
more susceptible to them?
Yeah, and that's, you know, we know the stress of homelessness itself can lead to not only mental illness, but physical illnesses. Oprah just recently talked about this big study called ACEs, which actually came out in like the 80s or 90s, but she just learned about it, and so now everybody's like, ooh, Oprah talked about that. So it was the study where they looked at, okay, does homelessness increase your risk of mental health? And maybe does it increase your risk of maybe other things? And what they found was like your increased risk of coronary artery disease, you're at increased risk of diabetes, you're at increased risk of all kinds of medical things, totally unrelated to mental health, just from being homeless. And early childhood trauma, actually. So just from having abuse in your childhood, you're at increased risk for heart disease and diabetes.
My brother takes part in the Tampa Bay Street Medicine, which provides medical care to homeless people. He's been doing it for pretty much all of medical school. But when I was applying for this program, he had kind of made me think about how we should go about finding affordable housing for homelessness. And this might be a complex question, but do you have any suggestions on going about that?
Finding affordable housing. I mean, I think what you guys will be doing, like finding out how much is already in place, is going to be really helpful. Because right now we think, oh, there's plenty of affordable housing out there. Just go get on the wait list, you know. But when we actually have a concrete number and we can say, this is how much affordable housing we have, and this is how many people who are in need of housing, like that's going to be really helpful. The affordable housing, you know, what's considered affordable is a third of your income, no more than a third of your income. And so there are places in Jacksonville, like the Liberty Center, where they take a third of your income, or if you have no income, it's $25 a month. And so what we need is more places that offer that. You know, like right now, if you guys go look for an apartment in Gainesville, it's going to be more than a third of your income. You probably don't have any income as a student, right? So I think identifying how much we have is actually going to be one step that's going to be really helpful. But then having community, people invest in their community. So Solzbacher actually, you know, built affordable housing at this village center. And they stepped up and said, this is what we need, so this is what we're going to do. And they found partners to help them do that. And I think it just takes society to say, this is important to us, and we want affordable housing. There's something called the NIMBY effect. Have you heard of that? What's that?
Not in my backyard.
Not in my backyard. Yeah, we want to end homelessness. We want you to build a homeless shelter, just not right next door to me, you know. And so, not in my backyard, but NIMBY. So that's one reason, like, they moved Grace Marketplace way out, you know, way at the end of the bus line, you know. It's not because it's convenient. It's because it's out of eyesight. services were located. And so a lot of it is society has to buy into things. You know, when you go around, I'd love to see the campus now with a different set of eyes, you know, like in Jacksonville, they have benches, public benches places, right? Well, one thing that they do to end homelessness is they put a bar in the middle of the bench so that you can sit on it, but you can't lay down. And so that's ending homelessness, right? No, that's just moving homelessness, you know? And so having, you know, instead of investing in benches with bars in the middle, why don't we invest in some HUD housing? Try to get more Section 8 housing in our city.
And I'll point out too, because that was a really good question. That would be a great interview question, especially if you're interviewing any city or county officials, because, you know, as we talked about during the orientation, the resources are always going to be there, but, you know, what do they have, or what could they do if they had more resources coming in, especially money, you know, as we talked about. So that's why, you know, something to get the folks that you're interviewing thinking about this, you know, is a question like that that can point to, you know, what could possibly be done if you were getting additional resources in that would target these aspects of the need for both increased housing and homelessness and the connection there between the two. Sorry.
Yeah, especially if they're working in it, you know, they might have good ideas of what is needed.
Other questions? Did I just kill it off completely? Are you feeling okay then?
Yeah.
All right. Well, thank you, Dr. Hannah Turner. And I did record this, so I will send out tomorrow so that all of you have it. There's a couple of you that weren't able to make it this evening as well. Please do make sure you talk to your mentors. Get those interviews trying to set up. And if you run into any issues, ask your mentor, ask me. We can figure out what's going on. If I wouldn't mind, a couple of you would help me stay in stacked chairs at the end. I'd appreciate it. Just the ones without arms have to go on the racks over there. Thank you. There is.